Hi, everybody. Happy Friday. Welcome to our Friday COVID vaccine chat. Today, we have a very special guest, Dr. Maggie Mamolen. Maggie actually is a family medicine physician. She retired 2 years ago from the Western Washington University Clinic. And earlier in her career, she worked in epidemiology and public health at the CDC and the Vermont Department of Health. So amazing guest to have today. And we have Dr. Chao-ying Wu, a family care physician at Family Care Network and a board member at the Check-A-Net Health Foundation. So today we're going to talk about COVID-19 vaccines and what's going on. And we'd love to focus on this term we've been hearing a lot, immuno-compromised. And Maggie, could you tell us a little bit about what does that even mean?
Well, yeah, with everybody who is getting vaccinated feeling happy and free to get back to their usual activities, that's not the case for everybody. And some people are immune compromised, and those can be from various conditions. Millions of Americans have psoriasis or rheumatoid arthritis or Crohn's disease. They might be taking steroids or some other newer immune suppressing medications to help control those conditions. Other people have had kidney transplants or other organ transplants, some kinds of cancers, and the medication being used to treat those. So all of those can mean that someone might be immune compromised, and we are not sure how well they respond to the vaccine.
What does it mean for immune compromised people? What does the vaccine mean for them? And what has COVID been like for them? Does it mean that they're more at risk of getting COVID? And to tell us more about the implications and why we should care about it.
Well, I actually have an immune compromising condition. It's a rare, probably autoimmune white blood cell condition. And so we've been very careful. Now that it's warm, we're seeing friends outside. But my husband goes shopping with a mask, even though he's vaccinated, because he doesn't want to bring something home to me. So it's big unknown. And the CDC is not recommending at this point that anybody get tested after the vaccine to see if they responded to it. It's not clear what tests would show. And you might have seen new things about whether people should get a third dose of the vaccine and whether that might be helpful. And there are some studies in France and other places showing that yes, it might be helpful. So there's lots of questions.
Ying, is there anything you would add about why as a community this is important for us to know about and be aware of?
Well, I think and Maggie, thank you for sharing that. I think the message here is that we can actually do a lot to protect each other. And, humans, biological systems in general occur on a spectrum. So one person might get a really robust response to the vaccine. Another person, even without an immunocompromising diagnosis, might have a lesser response. And then for the folks who have immunocompromising conditions or take medications that suppress their immunity, they have this unknown risk that we can't really quantify. And it's not easy to live with that kind of a cloud of uncertainty. And so the more we can provide a ring of protection around those people by immunizing all of their contacts, the better they'll be, and the more it relieves some of that uncertainty. And the other thing is, there are people out there with immunocompromising conditions who don't know that they have them yet. There are people who are coming down with the cancer. There are people who have, like a rare autoimmune disorder, but they don't know it yet. And they may not be getting the protection that they think they are from a vaccine. And so the more people we immunize, the more protected everyone is.
And I'll add to that, which you might have covered previously, but the more people who are infected, the more likely variants are to develop. Mm-hmm. And apparently in immune compromised people who might get a more serious infection with COVID. It might last longer. They might even be more a source of variants if they were to get infected. So in addition to protecting oneself, getting vaccinated protects everybody. So that's what's important both here and in other places where there's more infection.
Yeah. And I think it's important to remember that this virus, as far as we know, doesn't transmit except from person to person. And so you can imagine that if you have a ring of people around you, your contacts, and they're all vaccinated, then that's like the walls of a medieval fort. You know, that is not going to let that virus cross over, because it's not going to, you know, it's not going to get there any other way except through another person. So if all of your contacts are immunized, then you are well protected.
I think that's really helpful for us to remember and think about, that getting the vaccine isn't just to protect ourselves. It's also to protect people in our lives that we love. And so I think that's a really important takeaway to understand for everyone who's watching.
Yeah, it's no different than not driving when you're drunk.
Mm-hmm.
You know, you protect yourself, you protect everyone else on the road. You know, so we do a lot of things every day to protect not only ourselves, but our whole community. And this is just one of them.
Right. So you mentioned variants, and I couldn't help but notice at my coffee stand drive-through this morning, the headline on the Bellingham Herald is that the Delta variant has been detected in Whatcom County, and people are making some hubbub about this. And could you break down what this means and anything you think we should all know?
Maggie, do you want to go first?
Well, it appears that the Delta variant is more contagious, more infectious, and even probably more virulent. If you do get infected with it, people are ending up, who are not vaccinated, people are ending up in the hospital more, and the death rate is increased from this variant. This variant developed in India. It's why we need to, in addition to vaccinating as many people as we possibly can in our county and in this country, we need to help other parts of the world get vaccinated, because these viruses travel around the world. And there are variants from South Africa that we've seen and from other places. So this variant does seem like it's more contagious, but the vaccine does work to protect people from it.
Yeah, and I think people have raised the question, does the vaccine work as well for this variant? And there may be a small decrease in the effectiveness of the vaccine for this variant. But the thing to remember is that the vaccine is so stunningly effective to begin with, that even if it has a small decrease in effectiveness, it's still really, really effective and still totally worth it for the variants that we've seen so far. But I think Maggie's point is good about, you know, the amount of virus that's reproducing in people around the world is the pool out of which variants come. And so the most important thing we can do to control the spread of variants is to put an end to the pandemic. Locally, we have the ability to do that very rapidly. Worldwide is going to be a much bigger challenge, but as long as you have reproducing virus in large numbers, you are going to have variants come up one after the other after the other. And in some ways, you know, Delta being here is really non-news. It was always going to happen. And the only way out of this is to put an end to the pandemic. And the only way to put an end to the pandemic is to vaccinate enough of us that it stops transmitting. And that number, you know, how much is enough? No one knows exactly, but this is a really contagious virus. So I think 90% would be a good goal.
Yeah. We're still quite a ways away from that in Whatcom County.
I know. We are, but you know, we are really lucky in Whatcom County because we have ample medical facilities, we have ample vaccine, and people don't talk about this much, but truly we could put an end to this pandemic in our county in 4 weeks. It's completely achievable. We could put an end to this in Whatcom County in 4 weeks, and the fear and the restrictions would be a thing of the past. then we could turn our focus to helping the rest of the world, which is really huge. I mean, we are so lucky to have available the vaccine that we have.
Yeah.
Yeah, I mean, the availability of vaccine here just makes all the difference. We all remember when everyone was trying to find a vaccine. And I talked with my colleagues that I used to work with at Western, and students who are coming in to get the vaccine are so grateful that they are able to get it, and then they can hang out with their friends who are also vaccinated. Western young people have been a source of some of the cases in the county in the past, and hopefully that won't be the case going forward.
Yeah.
So we'll see about that. And then there's a question about at what point will everyone need a third dose? At what point would immune-compromised people benefit from a third dose? That there was a study in France among organ recipients who, after 2 doses of the vaccine, had only a 40% response to the vaccine. But after a 3rd dose of the vaccine, then they had a 68% response, which is still not as high as you see generally in healthy people, but it's a lot better. So all of those questions are rising, and you know, the NIH and the CDC are studying it, but there's no recommendations about that now.
We talked a few Fridays ago about watching science in real time and how that's been such an interesting part of how globally connected we are right now, and able to actually see how science works and how messy it is, and how that can feel scary to people because we want clear rules and guidance, but we're learning as we go. And so thanks for sharing about the studies that are happening right now. Ying, you talk a little bit too about how getting COVID is now optional.
Mm-hmm.
And I wonder if you want to share a little more about your thoughts and perspective. You're seeing patients, you're in the hospital from time to time.
Right. So, you know, I don't work in the hospital a lot, but I worked in the hospital over the holiday weekend. And, you know, it's still the case, as it has been for a couple of months now, that the only people in the hospital with COVID are folks who came in having not been vaccinated. So, or the positive way to put that is no vaccinated people have had to be hospitalized with COVID for months now. And so to me, that means getting really sick with COVID, needing to be hospitalized is a completely optional thing. Or as another doctor has said, COVID is an entirely preventable disease in the US. You get vaccinated and serious COVID, right? Serious COVID is a totally preventable disease in the US. You get vaccinated, you don't get really sick. That's all there is to it. And so that means getting really sick is optional. And, you know, it is true that a lot of people will get COVID and not be that sick. But if you're the one who winds up in the hospital with a tube up your nose and oxygen flowing there and gasping for breath for days, it doesn't matter that 7 of your friends got it and were fine. It just matters to you that you're really sick. And the other thing is, it hurts a lot. These folks are really uncomfortable. They kind of ache all over all the time. Fortunately, I haven't had it, but my patients have said it was really bad. It was really miserable.
Well, and in addition to keeping that from happening to yourself, you know, we don't want that to happen to our grandparents or, you know, other more vulnerable people. So it's
right.
It's
our baby
for everyone to get it for everyone.
Right.
Mm-hmm. Is there anything else that's been on both of your minds? It's so awesome to have a former epidemiologist on the call. It's really awesome to just have these chats with doctors and ask the questions that we all wish we could ask in our living room anytime. And what else is what have you been thinking about lately related to COVID that's interesting or devastating, or that you're worried about, or that you would just want to share with the community?
Maggie?
That's a good question. I mean, I do keep up on it. I'm in touch with some friends who are either back at CDC or have stayed at CDC. And, you know, I don't want to get into the politics, but it's just been very interesting how much people's political attitudes have affected how they respond to the idea of vaccination, to the idea of COVID being a risk to everyone. You know, that those issues are kind of perplexing to me because I'm used to public health being, you know, a scientific, accepted way that we are trying to keep everyone healthy.
Yeah.
Yeah, so I was on another conference call this morning on a related subject, and I was sharing this thought, which has really been weighing on my mind and a lot of my colleagues recently, which is that we are really concerned about the mental health of the community. You know, there are so many people, even the folks who are doing really well, really are feeling the weight of the isolation and the fear and the risk for this long period of time. Folks who are doing well are worried about their family members who are not. And there are a lot of folks, especially lately for me in my practice, it's been especially young people. The middle schoolers and the high schoolers and the young adults have really been impacted by this. And to me, that's another reason why we need to get this behind us, get everybody immunized and move on and do some healing as soon as we can, because there's a substantial mental health cost to what we've been through. And I think we really need to take positive, proactive steps to get past this phase where we're dealing mostly with the disease and get onto the phase where we're mostly dealing with healing and reconciliation. And, you know, it's been quite divisive, and patching up relationships and getting people back in touch with each other. And I'm really hoping that we'll see sort of a greater level of community engagement, especially across generations, because the kids need some help. And there's not enough mental health professionals, period. There just aren't. And in this time frame, there aren't going to be. So we're going to have to help each other with professional guidance.
That's really well said. And I have been in touch with some young people and people working with young people. And the Zoom telehealth thing has been one thing that has been helpful in that. A friend of mine is a therapist who's doing all of her appointments by Zoom, which, you know, has some pluses and minuses, but that availability hopefully will continue to be used in a way that's helpful.
Yeah. I think we're all really tired too of just the everyday risk assessment of what activities are safe and where do I need to wear a mask and can I go there because my baby can't get her vaccine yet and is she safe? And it's just tiring. It's really exhausting to constantly be assessing risk. So, and that weighs, I think, on the mental health for everybody as well, in addition to the isolation and just the dramatic changes we've all gone through as a community. And I agree with you, Ying. I hope that we heal together and that there's a lot more connection after this pandemic. So takeaways are that the vaccine is free. It's available to everyone. There are many locations that you can get it. You can look at the Whatcom County Health Department website. You can look at vaccinefinder.org, I think. Google that, Washington State Vaccine Finder. And most importantly, it's safe and effective and the fastest way that we can get out of this pandemic and stop doing risk assessments every day, at least in regards to COVID. So those are the—
It's not only the fastest way, it's actually the only way.
Yeah. So on that note, happy Friday to all our listeners. Please send your questions in. We will continue to do these Friday chats through July. And if you haven't gotten your vaccine yet and you still want to, you're actually eligible to enter your name in a drawing. We have a fun drawing to try and get more people vaccinated. So if you are interested in trying to win a truck, go to winatruckwhatcom.com and enter your name after you get your vaccine. So thank you, Maggie. Thank you, Ying, for joining us today. And I'm gonna say have a great weekend to everybody.
Yeah.
Thanks, Heather. Thanks, Maggie.
Yeah.